Central government waives off customs duty and health cess on import of oxygen and oxygen-related equipment for 3 months. Decision taken in the meeting held by Prime Minister Modi to review steps taken to boost oxygen availability in the country. Customs duty waived off for import of COVID vaccines as well. Prime Minister inaugurates distribution of e-cards to over 4 lakh property owners under Swamitva scheme. Says the scheme will boost confidence of the poor and lead villages on the path of development. PM also gives out awards on National Panchayati Raj Day. Prime Minister invokes cooperation of panchayats for vaccination drive in villages. Says COVID infection must be stopped from entering villages. Pradhan Mantri Garib Kalyan Yojana restarted to deliver free ration to poor. Justice N.V. Raman becomes 48th Chief Justice of India. President Ramnath Kovind administers oath of office and secrecy to the new Chief Justice. Efforts underway to meet oxygen demand across different states of the country. Oxygen Express reaches Varanasi, Lucknow, Nagpur and Nashik. Ministry of Home Affairs coordinating lifting of high-capacity tankers from abroad by Indian Air Force aircraft for movement of oxygen. And India reports record number of new Covid-19 cases, registers over 3,46,000 new cases of Covid-19. In last 24 hours, over 2,19,000 recoveries recorded. In the past 24 hours, taking cumulative total of recovered patients to over 1 crore 38 lakhs. Good afternoon and welcome to News Connect. Let's look at the top story. Prime Minister Narendra Modi chaired a meeting to review steps taken to boost oxygen availability in the country. Prime Minister emphasized that there was an immediate need to augment supply of medical-grade oxygen as well as equipment required for patient care, both at home and in hospitals. PM stressed that all ministries and departments need to work in synergy to create and increase availability of oxygen and medical supplies. Prime Minister was briefed that basic customs duty was exempted on remdesivir and its API recently. It was suggested that import of equipments related to providing oxygen to patients needs to be expedited. In order to augment their production and availability and to meet the rising demand, it was decided to grant full exemption from basic customs duty and health cess on import of the following items related to oxygen and oxygen-related equipment for a period of 3 months. Now, they include medical-grade oxygen, oxygen concentrators along with flow meters, regulator, connectors and tubing vacuum pressure, swing absorption, along with pressure swing absorption, oxygen plants, cryogenic oxygen air separation units, producing liquid gaseous oxygen, oxygen canisters, oxygen filing systems, oxygen storage tanks, oxygen cylinders including cryogenic cylinders and tanks, oxygen generators, ISO containers for shipping oxygen, among others. Apart from the above, it was also decided that basic customs duty on import of COVID vaccines be also exempted with immediate effect for a period of 3 months. Prime Minister directed Revenue Department to ensure seamless and quick custom clearance of such equipment. Important decisions taken at the high-level meeting chaired by Prime Minister. My colleague Arun Sharma is joining us with more updates. Arun, now that the customs duty has been exempted as far as import of oxygen and oxygen-related products are concerned, in what way is it expected to boost the oxygen supply, which is such a need of the hour at the moment?
Well, this move by the government will ensure that there is availability and the prices are contained primarily as far as the oxygen and oxygen-related equipments are concerned. Earlier, we know this fact, Shubhendu, that the remdesivir and the API for the remdesivir, the government had, slashed, and primarily you can say that the government has waived off the customs duty primarily on these injections and medicines. And now the government has taken this important decision when Prime Minister Narendra Modi chaired this important high-level meeting, and it was decided that there are many items that are related to oxygen equipment, or oxygen plants, or various other equipments that are needed for generation of oxygen or for the oxygen plant. So all these items on which there was a basic customs duty and the health cess, that will be waived off for the next 3 months. And to expedite this entire process, Mr. Gaurav Masaldan, the Joint Secretary in the Department of Customs, he has been made a nodal officer so that this entire procedure can be fast-tracked. The idea is that easy availability can be ensured, because on one side, government is ensuring that the corporate sector of our country, and how can the oxygen plants, the oxygen, the availability of the oxygen can be ramped up in the country. So on the other side, the government is also ensuring that how can imports can be done as soon as possible. We know this fact that as of now, the Indian Air Force plane is carrying the oxygen cryogenic tanks from Singapore.
Right.
Government is ensuring that imports can be done from various other countries as well. So as soon as these oxygen and oxygen-related equipments and various other equipments that are related to oxygen that are being imported to our country, they do not attract any kind of basic custom duty, number one. Number two, no health cess on that. And number three, to fast track all this process, the government has appointed a nodal officer also, so that there is a proper availability, and it is also economic in nature. There is no price hike due to primarily various import duties or custom duties primarily on all these equipment. So in that context, this is going to be very much important. Another important decision has been taken by the government in this high-level meeting is that the COVID vaccines primarily will not be having any kind of duties, will not be attracting any duties. So this will also ensure that there is proper availability of the COVID vaccine as well. So yes, the government is ensuring that how can oxygen-related equipment and infrastructure that can be ensured, and it can be ensured that there is proper availability of all this equipment. And in that context, this decision is going to benefit a lot, but to the people who are suffering from this COVID crisis as of now.
Right there, Arun. Thanks very much for joining us with those updates. Moving on, Union Home Minister Amit Shah today inaugurated an oxygen plant at the Ayurvedic Hospital in Kolwara village of Gandhinagar, Gujarat. Gujarat Chief Minister Vijay Rupani, State Deputy Chief Minister Nitin Patel were also present at the event. Ministry of Home Affairs is coordinating lifting of high-capacity tankers from abroad by Indian Air Force aircraft for movement of oxygen required due to current surge in COVID cases in the country. Liquid oxygen containers were loaded at Changi Airport, Singapore today. As COVID-19 hospitals across the country face oxygen shortage, Indian Air Force aircraft flew to Singapore to get oxygen containers to meet the surging demand. Another Indian Air Force flight will fly to UAE to get oxygen tankers in India. As India faces its worst health crisis in decades, Indian Air Force has been pressed into action to facilitate faster transportation of medical oxygen as well as health staffers across the country. At Pune, oxygen cylinders were loaded in Air Force plane today. The plane landed at Jamnagar around 1:30 p.m. Indian Air Force and Indian Railways are helping transport medical oxygen at various states across the country, which are facing acute shortage of oxygen. With the rising number of COVID-19 cases in the country, there is a huge demand for oxygen. And Armed Forces Medical Services has deployed additional doctors, including specialists, super specialists and paramedics at Sardar Vallabhbhai Patel COVID Hospital in Delhi to cater to the current surge in COVID-19 cases. As against 294 doctors and health workers in 2020, 378 of them have been mobilized this year. These include 164 doctors in 2021 as against 132 doctors last year. Last year, only 18 specialists were mobilized as against 43 specialists and 17 super specialists this year. Defence Minister Rajnath Singh reviewed the efforts of Ministry of Defence and 3 services to fight against the current wave of COVID pandemic. Rajnath Singh reiterated that armed forces and MOD will leave no stone unturned in providing all possible assistance to the civil administration. Rajnath Singh, in a series of tweets, said, reviewed the efforts of Ministry of Defence and the 3 services to fight against the current wave of COVID pandemic. Through video conferencing facility, the armed forces and MOD will leave no stone unturned in providing all possible assistance to the civil administration. DRDO is adding another 250 beds later in the evening at Sardar Vallabhbhai Patel COVID Hospital in New Delhi, taking the total number of beds to 500. In Gujarat, a 1,000-bed hospital has become operational. Work is in full swing to establish a COVID facility in Lucknow that would become operational in the next 5 to 6 days. This hospital would be run by AFMS in coordination with the Uttar Pradesh government. All health facilities of Defence PSUs and Ordnance Factory Board have been allowed to provide health services to local COVID-19 affected population. The MOD official said 3 services are closely monitoring the progress of various initiatives taken by the ministry. And my colleague Nandita Ragor is joining us with more updates. Nandita, give us an overview of the manner in which the defence forces are supporting and boosting COVID healthcare, particularly the oxygen supply chain in the country.
Yes, the Air Force has pitched in a very major way, Shubhendu. As you have just mentioned, and we've shown visuals also, the video of empty containers from Singapore airport being loaded into the C-17 strategic lift aircraft of the Indian Air Force, and then it is today evening it is expected to reach Panagarh, where nearby there is an oxygen filling station, and then from various other parts of the countries a round trip is saved because the empty cylinders, because you cannot carry full cryogenically pressurized oxygen in aircrafts. This is not permissible either, and it's not advisable also, considering that it could be it's a explosive cocktail of chemicals. Then they are carrying from Jodhpur, Pune, places like that. They are flying to Jamnagar, and because they are trying to boost the oxygen carrying capacity over there. Also, apart from that, we just saw today around noon, the defense, just a little after noon, the defense minister held consultations, and he was briefed on the fighting, the measures taken by the armed forces in fighting the COVID pandemic, be it the ferrying of these oxygen cylinders or oxygen setup, testing centers to places like Leh, also the setting up of hospitals. You've already enumerated through some of the tweets, but apart from that, a few very essential and very critical decisions have been taken by the Defence Ministry, such as extending the commission of the short service commission doctors up till December this year, to the end of this year. So this will give increase the number of doctors to 238 extra doctors, because those who were retiring very soon in this month or in the coming months, their services have been extended up till 31st of December this year. Also, emergency financial powers have been given to the Lieutenant Generals, Vice Admirals, Air Marshals, and the officers below of the Army, Navy and Air Force Medical Services, which means that these surgeons, these doctors of the 3 services from which belong to the Armed Forces Medical Services Corps, they have emergency powers to procure medicines, stores, equipment. The Lieutenant General and equivalent to up to rupees 300 lakh worth equipment and stores and medicines. Major General and equivalent rupees 300 lakh, sorry, the Lieutenant General 500 lakh rupees, the Major General 300 lakh rupees, and brigadiers up to 100 lakh rupees. And of course, we see the Defence Minister reviewing every day ordnance factory boards and public. Yes.
Right there, Ananta. Thanks very much for joining us with those inputs. Meanwhile, as Delhi battles Covid-19 surge with its back to the wall, a Covid care facility with oxygen supply is ready to cater to patients. Sardar Patel Covid Care Centre in Radha Swami Satsang Byas at Chhatarpur, Bhati, with 500 oxygenated beds will be functional by tomorrow. Correspondent Ravi Dhiman has details.
This is the Sardar Patel Covid Care Centre at Radha Swami Satsang Byas Centre in Bhati in Delhi. Preparations are very fast paced to ensure that at least 500 bed facility can be opened for the citizens of Delhi and NCR who are facing a huge colossal crisis, we can say, as far as health infrastructure is concerned. The hospitals of Delhi and NCR are overflowing with patients who want admission in the hospitals and want the oxygen facilities. Due to it, the health infrastructure of NCR is close to completely crumble down. This facility with 500 beds initially come as a huge relief for the citizens of Delhi, for the administration of Delhi and for the doctors and health infrastructure of Delhi. It will add 500 beds, and with almost all of them will be equipped to supply some sort of oxygen to the patients. There are 350 concentrators here and 150 cylinders. So all the 500 beds can be equipped with oxygen supply if there is a need of that. And this facility will be ready to cater to the needs of citizens of Delhi. With cameraman Sumit, Ravi Dhiman, DD India, Delhi.
And Saket SDM Ankita Mishra said that Sardar Patel Covid Care Centre will be helpful in dealing with the situation in the capital. In an exclusive conversation with DD News, she also said centre is being started with 500 beds, but that can be scaled up in future if there is a need for that. She also praised the ITBP for their professionalism and the work in a situation like this. The centre will begin functioning from tomorrow.
This will come as a huge relief to the citizens of Delhi and to the administration, which has been fighting literally with its back to the wall, given the recent surge in Covid-19 cases in Delhi NCR. We have with us an official of the Delhi government, SDM Saket, Ankita Mishra.
As you can see, I mean, the case load right now in Delhi is quite a lot. The positivity is very, very high. And Delhi not only caters to its own population, but to a significant chunk of population from the NCR and also of the major capitals of our adjoining states. So this would of course come as a huge relief, because right now what we are seeing that the strain that is there, उसमें हमें oxygen beds की बहुत ज़रूरत पड़ी है. People who don't require oxygen generally think they'll get themselves treated at home only. So this facility having 500 oxygenated beds would of course be very helpful in the current situation.
Last time around, this facility had 10,000 beds. Yeah. So are you planning to increase the number of beds?
Of course, as the requirements come, we will scale it up. But to start with, because we had very little time to start with this facility, so we have started with 500 beds. If need be, we will scale it up as well.
And what do you think of the facilities here for the patients and for the support staff by RSSB? Has it been up to the mark, just like last?
Of course, ITBP is a very professional force that way, and last time also the experience has been really good, and it had acted as one of the most successful examples of healthcare facilities. So I'm sure this time also ITBP would do a wonderful job, a great job. The doctors are very cooperating and they're very professional, so I'm sure that this facility would be a great help.
Starting with 500 beds, it will be scaled up further as the need arises, and given the current COVID surge in the city, the need will definitely arise in days to come, and this facility will be ready to cater to the needs of citizens of Delhi. With cameraman Sumit, Ravi Dhiman, DD India, Delhi.
N90C Limited is airlifting 24 cryogenic ISO containers from Asian countries in collaboration with Lind India Limited to serve the national priority and government's effort in easing bottleneck of medical oxygen supply to hospitals. ITC in a tweet message said, to serve the national priority and government's effort in easing bottleneck of medical oxygen supply to hospitals, ITC is air freighting 24 cryogenic ISO containers from Asian countries in collaboration with Lind India Limited. And also, in addition, it is airlifting large number of oxygen concentrators, a paper unit in Bharatchalam and other places. ITC is airlifting 24 cryogenic systems, which is crucial to tackle the situation at the moment. And moving on to the other story, Oxygen Express train loaded with liquid medical oxygen tankers from Vizag has reached Nasik district of Maharashtra today. 4 oxygen tankers have been unloaded by the Indian Railways to provide additional oxygen to COVID patients. Yesterday, Oxygen Express through Ro-Ro service from Visakhapatnam steel plant, siding with 7 liquid medical oxygen tankers, arrived at Nagpur station in Maharashtra, where 3 tankers were unloaded. Minister of Railways Piyush Goyal took to Twitter to post a clip of the train reaching at Nashik, highlighting that Railways transported essential commodities and kept the supply chain intact even during the lockdown last year and continue to serve the nation in times of emergencies. India is continuing to vaccinate its population against COVID-19. India started the world's largest vaccination drive in January. Till date, 13,83,79,832 people have been administered with COVID-19 vaccine in the country. Over 29 lakh vaccination doses were administered in the country in the past 24 hours. The country will begin to vaccinate all its citizens above 18 years from 1st of May. To get their jab, they can register on the CoWIN portal and the Arogya Setu app starting 28th of this month. Let's also take a look at the COVID-19 situation in terms of data in the country. The country has been reporting record number of new COVID-19 cases in the recent past. In last 24 hours, India has registered 3,46,786 new cases of COVID-19. 2,19,838 recoveries were recorded in the last 24 hours, taking the cumulative total of recovered patients to 1,38,67,997. With this, the recovery rate currently stands at 83.49%. India's total active caseload stands at over 25 lakh as of today. The country's present active caseload comprises 15.37% of the total positive cases. In the last 24 hours, 2,624 people have died of COVID in the country. The deadly virus so far has claimed the lives of a total of 1,89,544 people across India. Meanwhile, according to Indian Council of Medical Research, 27,61,99,222 samples for COVID have been tested so far across the country. Out of this, 17,53,569 samples were tested just yesterday. The admissions in the emergency were restricted for an hour as oxygen pipelines were being reorganized due to increased requirement of oxygen for COVID-19 patients. Currently, around 100 coronavirus infected patients are already receiving treatment at the emergency facility. This is in addition to more than 800 patients who are already admitted at various centers of All India Institute of Medical Sciences in Delhi. Admissions are open and emergency department is functional, the officials informed. In view of the COVID pandemic, certain time limits specified under various tax and Benami laws have been extended by the Taxation and Other Laws Relaxation and Amendment of Certain Provisions Act 2020 and subsequent notifications issued under this Act. Representations have been received from taxpayers that the last date for intimating the Adhaar number may further be extended in the wake of the ongoing COVID-19 pandemic. Keeping in view the difficulties faced by taxpayers, the central government has issued notification today extending the last date for intimation of Adhaar number and linking thereof with PAN to 30th June 2021. Amid shortage of medical-grade oxygen for rising number of COVID-19 patients in the country, CSIR, Central Mechanical Engineering Research Institute in Durgapur, indigenously developed oxygen enrichment unit, which can be potentially lifesaver in COVID times. Here's more by my colleague Tapash Bhattacharya.
With the paucity of oxygen gripping the country in general and the national capital in particular, CSIR CMR's oxygen enrichment unit, which is a portable one, is expected to be a boon for all those people who are suffering from COVID-19 disease.
In an effort to provide an inexhaustible supply of oxygen to hospitals, CSIR, Central Mechanical Engineering Research Institute in Durgapur, has developed an oxygen enrichment technology. It is a device which concentrates oxygen from the air around us by selectively removing nitrogen to supply an oxygen-enriched air. The concentrated oxygen is delivered to patients having respiratory diseases through oxygen mask or nasal cannula. The device can be used in remote areas, in homes or hospital-like facilities for patients with chronic obstructive pulmonary diseases, COPD, and chronic hypoxemia.
And this technology requires locally available resources like a compressor, like a molecular C, which is zeolite based, pneumatic connections. See, these are available locally and it can be manufactured. This kind of units can be manufactured from various MSMEs. It doesn't require a very high cost. And if they manufacture and distribute and they can provide to even the local hospitals, we will be able to fight against the COVID without much problem. We will win the COVID and we will be able to provide oxygen to almost every needy person.
The Oxygen Enrichment Unit developed by CSIR, CMERI, is capable of delivering up to 30 LPM oxygen-enriched air, which is absent in the other commercially available units. The material cost of this unit is approximately 35,000 rupees, and the technology has been transferred to a company in Telangana. Tapas Bhattacharya's report, DD India.
The impact of weekend lockdown imposed by Uttar Pradesh government to prevent corona pandemic is being observed. The weekend lockdown were announced across the state 3 days ago, every Friday night from 8 p.m. till 7 a.m. on Monday. The strictness during the weekend lockdown is seen at many cities of the state, including capital Lucknow, Kanpur, Varanasi, Agra, Noida, Gorakhpur. The administration is taking strict action against people who are roaming around without any reason during this period. Only people in essential services are allowed during the lockdown period. Apart from this, people under corona vaccination and medical field are also being exempted. Along with this, a night curfew was announced in the entire state. Earlier, night curfew was announced only across 11 districts. And weekend curfew continues in Pune, Maharashtra, amid rising Covid-19 numbers. Only medical shops are allowed to remain open and all other shops remain closed. Pune district reported 9,810 fresh cases and 137 casualties just yesterday. The Mumbai police today discontinued the red, yellow, green emergency stickers but said thorough checks will continue in the city amid rising COVID cases. The police has asked the residents of Mumbai to avoid all non-essential, non-emergency movement outside homes. Last week, emergency stickers categorization were introduced by Mumbai police to allow for movement of private cars during curfew in the state of Maharashtra. Under the color-coded sticker scheme, vehicles belonging to doctors, medical staff, ambulances and those engaged in supplying medical equipment were required to sport red stickers, while cars transporting food, vegetables, fruits, groceries, dairy products were supposed to use green stickers. Prime Minister Narendra Modi launched the distribution of e-property cards under Swamitva scheme today on National Panchayati Raj Day through video conferencing. Over 4 lakh property owners were given their e-property cards on this occasion, which also marks rolling out of Swamitva scheme for implementation across the country. Union Minister Narendra Singh Tomar attended the event. Chief Ministers and Panchayati Raj Ministers of concerned states were also present. PM said Panchayati Raj Day is an occasion to rededicate ourselves to the pledge of redevelopment of rural India. This is a day to acknowledge and appreciate extraordinary work of our Gram Panchayats.
आज देश अपनी हर नीति और हर प्रयास के केंद्र में गांवों को रखकर आगे बढ़ रहा है। हमारा प्रयास है कि आधुनिक भारत के गांव समर्थ हो, आत्मनिर्भर हो। इसके लिए पंचायतों की भूमिका को बढ़ाया जा रहा है। पंचायतों को नए अधिकार दिए जा रहे हैं। पंचायतों को डिजिटल बनाने के लिए हर गांव को फाइबर नेट से जोड़ने का काम भी तेजी से चल रहा है। आज हर घर को शुद्ध जल देने के लिए चल रही जल जीवन मिशन जैसी बड़ी योजना की जिम्मेदारी पंचायतों को सौंपी गई है।
Prime Minister informed under Pradhan Mantri Garib Kalyan Yojana, every poor person will get free ration in the months of May and June. Scheme will benefit 80 crore beneficiaries and centres spending more than 26,000 crore on the scheme.
साथियों, इस मुश्किल समय में कोई भी परिवार भूखा न सोए, गरीब से गरीब का भी चूल्हा न जले, ये भी हमारी जिम्मेदारी है। कल ही भारत सरकार ने प्रधानमंत्री गरीब कल्याण योजना के तहत मुफ्त राशन देने की योजना को फिर से आगे बढ़ाया है। मई और जून के महीने में देश के हर गरीब को मुफ्त राशन मिलेगा। इसका लाभ 80 करोड़ से ज्यादा देशवासियों को होगा। इस पर केंद्र सरकार 26,000 करोड़ रुपए से अधिक खर्च करेगी।
And Prime Minister urged people to observe all precautions to curb Covid-19 pandemic. He said the cumulative efforts of panchayats, the nation can tackle this pandemic.
हमें सारी सावधानियों का पालन भी करना है और ये भी सुनिश्चित करना है कि गांव के हर एक व्यक्ति को वैक्सीन की दोनों डोज भी लगें। भारत सरकार अभी 45 आयु के ऊपर के हर व्यक्ति का मुफ्त टीकाकरण कर रही है। हिंदुस्तान के हर राज्य में कर रही है। अब 1 मई से 18 साल की उम्र से ऊपर के लोगों को टीका लगाने की प्रक्रिया शुरू होने वाली है। आप सभी साथियों के सहयोग से ही ये टीकाकरण अभियान सफल होगा।
Prime Minister also urged children not to skip their studies. He said Gram Panchayats at their level must contribute providing education to all children.
गांव के सभी बच्चे और विशेषकर बेटियां स्कूल जाएं, कोई भी बीच में पढ़ाई न छोड़े। आप सबको मिलकर ये जिम्मेदारी निभानी चाहिए। ऑनलाइन पढ़ाई को लेकर ग्राम पंचायत अपने स्तर पर किस प्रकार गरीब बच्चों की मदद कर सकती हैं, इसमें आप जरूर अपना योगदान दें। मिशन अंत्योदय सर्वेक्षण, इसमें जो गांव की जरूरतें, जो कमियां सामने आती हैं, हर ग्राम पंचायत को उन्हें दूर करने के लिए लक्ष्य निर्धारित करने चाहिए। अभी की इन परिस्थितियों में पंचायतों का मंत्र होना चाहिए, दवाई भी कड़ाई भी।
Some other news now. Justice N.V. Raman took oath as the 48th Chief Justice of India. President Ramnath Kovind administered the oath of office at a brief ceremony held at Rashtrapati Bhavan. He succeeds Justice Sharad Arvind Bobde, who demitted office yesterday. Justice Raman will have a tenure of some 16 months as the Chief Justice and is due to retire on 26th of August next year. Justice Raman was enrolled as an advocate in February of 1983. He was appointed as a permanent judge of Andhra Pradesh High Court in June 2000 and functioned as active Chief Justice of Andhra Pradesh High Court from March to May 2013. Justice Raman was elevated as the Chief Justice of Delhi High Court in September 2013 and was elevated as Judge of the Supreme Court on February of 2014. 384 persons have been rescued from Somna near Joshimath, Uttarakhand by the Indian Army. 6 of them are critical and currently under medical treatment. 8 bodies have been recovered. The rescue operation is in progress. The incident took place when a sudden glacial burst at Sumna yesterday at 4 p.m. disrupted the normalcy at Joshimath region. Road Malari to Sumna has been extensively damaged due to the multiple landslides. The area has experienced heavy rains and snow since last 5 days and is still continuing. Uttarakhand government issued an alert following news of the glacier burst. Uttarakhand Chief Minister Tirath Singh Rawat conducted an aerial survey of the Sumna area of Joshimath sector in Chamoli district.
कल रात जैसे हमको जानकारी मिली तो तत्काल मैंने यहाँ जानकारी की जियान प्रशासन से सभी से और साथ में ही रात को गृह मंत्री माननीय अमित शाह जी से भी बातचीत हुई, उनका भी फ़ोन आया और तत्काल हमने NDRF और जिला प्रशासन पूरी तरह मुस्तैदी के साथ में तत्काल जुटा और साथ में ही माननीय अमित शाह जी गृह मंत्री जी ने कहा कि जो भी आवश्यकता हो हम तुरंत एक्शन ले रहे हैं और ITB भी बिहार सभी आदमी को पूरी तरह सचेत किए तेजी से रेस्क्यू हुआ है.
CBI has registered an FIR against former Home Minister of Maharashtra, Anil Deshmukh, and others for allegedly extorting money from bar and restaurants across the city of Mumbai with the help of Crime Intelligence Unit. CBI is carrying out searches at different locations of Deshmukh. Deshmukh had to step down from the government after a division bench of Bombay High Court had ruled a preliminary inquiry against him and also granted liberty to CBI to lodge an FIR against him if the agency deems fit. Former Mumbai Police Commissioner Parambir Singh had alleged that Deshmukh had asked CIU Chief Sachin Vase to collect 100 crore rupees from the hotels and bars in Mumbai on a monthly basis. Vase also wrote a letter while he was in NIA custody endorsing the version of Parambir Singh. Prime Minister Narendra Modi today welcomed the US decision to join the Indian-Swedish Climate Initiative Leadership Group for Industry Transition and said it would help meet the Paris Agreement goals. In his address to the virtual summit on climate change, US President Joe Biden said he is looking forward to working with Prime Minister Modi in new partnership to achieve climate and energy goals, making this a core pillar of bilateral cooperation. Some news from across the world. The search for the missing Indonesian Navy submarine, which was lost in Bali Sea with some 53 crew members, is underway at war footing. There are fears that the submarine would be rapidly running out of oxygen, if not already crushed by the water pressure. Indonesian Navy staff of Yudo Margono said an object with high magnetic force had been spotted floating at a depth of 5,200 meters at an aerial search, had earlier spotted an oil spill near the submarine's last location. 44-year-old KRI Nanggala 402 lost contact on 21st April as it prepared to conduct a torpedo drill. Indonesia's Navy said it was investigating whether the submarine lost power during a dive or could not carry out emergency procedures as it descended to a depth of some 700 meters. India is airlifting C-17 and 2 IL-76 of the Indian Air Force from Mumbai and Vizag to Indonesia to help the country with the search and rescue of its missing submarine. 1 C-17 and 1 IL-76 from Mumbai and 1 from Vizag will be utilized for the operation. Transport aircraft was positioned at Mumbai and Vizag on Friday for loading of equipment and will fly out to Surabaya in Indonesia. Meanwhile, Pentagon on Friday confirmed that the US military is dispatching aircraft to aid in the search for the missing Indonesian Navy submarine as well.
At the request of the Indonesian government, we are sending airborne assets to include a Navy P-8 Poseidon maritime patrol aircraft to assist in the search of their missing submarine. Indonesia is a good friend and a strategic partner. We were all deeply saddened to see the reports about their submarine, and our thoughts and our prayers are with the Indonesian sailors, the Indonesian Navy, and of course all their families.
East Jerusalem was on the edge just after midnight on Saturday as Palestinians faced off with Israeli police in nightly Ramzan clashes that sparked rocket fire by militants in the Gaza Strip and protest in Palestinian towns across the occupied West Bank. Tension is mounting in the Holy City after Thursday's protests by Palestinian youth angered with curbs and gathering during the Muslim holy month, and by Israelis enraged by recent Palestinian street attacks on religious Jews. Arrests and injuries raised tensions that spilled over into Friday night and early Saturday when Palestinian youth again congregated outside the walled Old City and scuffled with hundreds of police in riot gear. Palestinians pelted stones towards police firing water cannons. Others hurled rocks at an Israeli court building and smashed security cameras. An Air Force of Zimbabwe helicopter crashed on a Friday, killing 3 crew members and a child on ground as it came down on a house. The helicopter was on a training mission with 2 pilots and a technician when it disappeared off the radar. It came down on a house in Arcturus. Visuals show security forces conducting an investigation around the charred parts of the helicopter. Zimbabwe's Air Force complained that its helicopter and fighter jets are old, but they have not been able to buy new ones due to sanctions by Western countries. US President Joe Biden will travel to the United Kingdom and Belgium in June. This will be his first overseas travel and will highlight his commitment to restoring US alliances, revitalizing the transatlantic censorship and relationship, working in close cooperation with its allies and multilateral partners to address global challenges and better secure America's interest. US President Biden will attend the G7 summit in Cornwall, UK, which will be held from 11th to 13th of June. He will also hold bilateral meetings with fellow G7 leaders, including British Prime Minister Boris Johnson. From the UK, Biden will travel to Brussels, Belgium, where he will participate in the NATO summit on the 14th of June. He will also hold bilateral meetings with fellow NATO leaders. US President Biden will participate in a US-EU summit as well. United States will immediately resume use of Johnson Johnsons Covid-19 vaccine, clearing the way for shots in arms as early as Saturday. The Centers for Disease Control and Prevention and Food and Drugs Administration said in a joint statement that they will warn of the risk of potentially fatal syndrome involving severe blood clots and low platelets in a fact sheet given to recipients. Earlier on Friday, the CDC panel voted 10-4 that J&J vaccine will be used as recommended in people 18 years of age and older, the parameters of its current FDA authorization. Colombia reached the grim milestone of 70,000 Covid-19 casualties this week, with its highest daily death toll since the start of the pandemic. Colombia has extended measures such as night curfews and limits on who can enter shops and other businesses by 2 weeks. This is part of efforts to curb a third wave of coronavirus. Colombian President Iván Duque said that the Andean nation had recorded 430 coronavirus casualties, a record since the start of the pandemic. Colombia reported more than 2.74 million coronavirus cases as well as 70,000 casualties and more. More than 3.7 million vaccine doses have been administered so far. The EU executive arm head Ursula von der Leyen said that the European Commission will conclude a deal with BioNTech Pfizer for the delivery of some 1.8 billion coronavirus vaccines over 2021 to 23 in the next few days. She added that EU Commission may eventually expand its portfolio of COVID-19 jabs to protein-based vaccines. The vaccines currently being developed by Novavax and Sanofi, GlaxoSmithKline, are protein-based vaccines, and the Commission would seek to screen future partners based on their reliability. Forest of Hellebos in Belgium, a carpet of bluebells this year, fears that the crowds of visitors could pose a risk of coronavirus infection. COVID has prompted local authorities close to the park and issue warning for people to stay away. In a normal year, up to 100,000 people flock to Hellebos, 15 kilometers south of Brussels. The flowers bloom in the ancient forest at the end of April and are famed tourist attraction, but authorities have expressed concerns that the parks could become crowded, particularly at weekends. The bus that brings visitors to the wood from the station has been cancelled and facilities including on-site toilets have been closed. Some sports update. Indian boxer Sachin on Friday added an unprecedented 8th gold to the country's historic medal haul at the Youth World Championship in Poland. Sachin won men's 56 kg title. The triumph comes a day after all 7 women swept the top honours in an astonishing performance. Sachin rallied to defeat Kazakhstan's Yerabalat Saber 4-1 in a gritty performance. India thus ended their campaign in the sporting event with 11 medals, including 8 gold, 3 bronze medals to claim the top spot in the overall standings. This was an improvement on 2 gold, 2 silver, 6 bronze medals claimed at the event's 2018 edition. 4 astronauts from 3 countries docked at the International Space Station today after launching from the NASA's Kennedy Space Center in Florida coast early on Friday as part of NASA's SpaceX Crew 2 mission. After about 23-hour ride, the Crew Dragon spacecraft docked at the ISS for the second time. The Dragon capsule docked autonomously with the orbiting outpost 260 miles above the Indian Ocean. The new arrivals, representing the US, France and Japan, will spend 6 months at the space station. It was the first time 2 SpaceX Crew Dragons were parked there at the same time, practically side by side. And with that, we conclude this edition of News Connect. Namaskar.